All right, so welcome everyone. Welcome to the application clinic for today. I'm super excited to be doing this. Actually, it's the first time that I am doing this. And I just wanted to kind of bring a bit more transparency around how I actually look at supporting statements, how I review them, how I critique them. So a big thank you actually to the people who did submit their statements. I know it must feel quite exposing, but just to kind of say that all the kind of feedback, the critiques are all going to be done in a really respectful manner, and the whole point here is to just kind of learn, and it's not just going to all be about how any kind of mistakes made, but also what the statements have actually done well. So something else to consider as well is that I haven't really looked at the statements that much before because I wanted it to be quite raw and unfiltered. So you're really going to be getting my raw kind of impressions, and you're going to really just be seeing my kind of straight up thinking process when I am looking through supporting statements. So hopefully that will be useful, and the way we can sort of structure it is we can do 20 minutes on one statement, 20 minutes on another statement. So I will keep an active eye on the time, and then I'll leave 20 minutes for a Q&A at the end, because I imagine some people will also have some questions as well. So we should be done by around 2 o'clock. And if it's a bit later than that, that's also a bit fine, but I will try and keep it on time. So let me just admit one more person. So I won't be able to admit anyone else because once I share my screen, I won't really be able to see that much. So I will get my screen started now. All right, so let's double check this is the right person spec. So is everyone, if someone could maybe just sort of say whether they can see my screen, that would be quite helpful. But if not, I'll just sort of assume everyone maybe can see it.
Yes, I can see it.
Yeah, okay, perfect. Thank you so much. So let's just get this out of the way. So the way I'm going to be doing this is I've got the statement here, and then I've got the person specification for the statement on the side. So the first thing, so we'll just have a quick look here. So it's written in prose. It's more of like a narrative statement, which I personally think is the nicest way to write a statement. It will always depend on the service. Some services will actually just want you to, list out the different criteria and then address how you meet them. But I think for a lot of supporting statements, a lot of services, this format does work quite well. I am just hearing a few other people come in. So let me I will just admit a couple of people here. Yeah. Oh yeah, sorry about this. It's always a bit. Okay, yeah, I don't think I'm able to do it. So people who aren't able to attend, that they can just watch the recording after. So oops, wrong thing that I've opened. Sorry about that. All right. So the first thing I'm going to do is I'm going to have a look at the person spec and see what we've got here. So this is for an assistant psychologist. The service wasn't actually very specific and not what I could really see from the job requirements. But it seems the experience that is needed seems to be quite research oriented. So experience of quantitative research, the desirable criteria is research in the NHS. And it seems like the skills are sort of oriented towards that as well. So we need skills using microcomputers, SPSS, and then it seems that there are some clinical oriented skills like communicating sensitive info. And then we've got quite standard knowledge of mental health, knowledge of quantitative research, high standard of report writing, understanding of psychology applied to healthcare. So these are quite sort of general competencies for AP roles that I've come across. And then if we go down, very similar, an ability to interact effectively with staff from all disciplines, ability to interact with clients with mental health problems, to work independently and work consistently, and ability to accept supervision and travel independently. So yeah, quite standard, I would say. It doesn't seem like there's anything particularly specialized about this AP role. So let's start having a look at the statement here. So I'm going to be reading it out alongside and then kind of giving my thoughts as we go on. So as a psychology graduate with experience working with individuals, learning disabilities, and a strong interest in trauma-informed care. So this is a nice opening sentence. However, quite a small thing, but also quite important, is the grammar in this sentence. So it should technically be a continuation into this sentence as just one whole sentence. So it should be, as a psychology graduate with experience working with individuals with learning disabilities and a strong interest in trauma-informed care, this role would be the perfect opportunity for me to further develop my skills and knowledge in an assistant psychologist role. So again, it's not like this is something that would automatically sort of, you know, take you away as a strong competitor, strong candidate, not competitor. But it does just kind of demonstrate something around, you know, ability to use grammar in the way that it should sort of be used and using it correctly. Because especially if, you know, we've got this person spec of high standard of report writing, that is going to need quite high levels of, well, not high levels of grammar, but just kind of correct grammar in that sense. So just something to be mindful of. You know, what can be quite useful before you submit your statement is going, even kind of putting the statement through AI just to double check all like grammar or spelling mistakes and stuff like that. That can be a really useful use of AI there. So then we've got, across my clinical and voluntary experiences, I've seen how valuing the perspectives of service users, carers, and multidisciplinary teams makes a difference by enhancing engagement and better outcomes. Not really much to say about this. I think it is, again, it's nice. It demonstrates the sort of keenness and the, you know, maybe the passion that this person does have towards working in the NHS and working in this type of service. And then we've got, as an aspiring clinical psychologist, I'm passionate about contributing to a service that actively promotes person-centered care and inclusivity. So I actually really like this sentence for two reasons. Because for one, we're highlighting a goal and the long-term goal of becoming a clinical psychologist. So the reason that I find that this is quite important is that an AP roles are considered stepping stones. So people know that if you're going to be going into an AP role, that you're not going to be staying there. The eventual goal is ultimately, you know, usually towards some sort of doctoral training if you want to become a psychologist. So there is that sense that if you apply for this AP role, the NHS is going to be investing in you, and they're investing in you to stay in the NHS. So I think it is just, and maybe what could actually be nice here and to make it kind of take this even further is, as an aspiring clinical psychologist in the NHS, and making it super specific that this person wants to work in the NHS. So that's just like a little kind of note there. And then we have, I'm passionate about contributing to a service that actively promotes person-centered care and inclusivity. So what's nice is that I think it demonstrates that this person has done their homework around the service. If we go down, onto the person spec here, we can see that there are a number of different values that would indicate that idea of person-centered care and inclusivity. And we've even got inclusivity here as one of the behaviors that would correspond to a value. So you're getting in those keywords right from the beginning, and you're making it very clear that you're aware what the service values, and your values also seem to sort of resonate with that as well. So let's go, I'll just pop this up here. Let's go into the second paragraph. So in my current role working as an SEMH teaching assistant, I've developed strong skills in building therapeutic relationships, managing challenging behaviors, working collaboratively with children and multidisciplinary professionals to provide safe and high quality care. So, for example, recently I supported a non-English speaking child with autism who was partially nonverbal, and the few words he spoke was in his mother tongue, which I also speak. Due to the language barrier, staff were finding it difficult to understand his needs, leading to frustration and an increase in challenging behaviors from the child. By translating what the child was expressing, I was able to help the staff better understand his needs and reduce his distress. It felt nice to be able to find a way to help him, and also reminded me of the importance of cultural sensitivity and clear communication when building these therapeutic relationships. So this is a lovely paragraph, I think. You're kind of going straight into, okay, what is it that I'm actually doing? And it sounds like this person is actually engaging in quite nice one-to-one work, which is amazing. And they're giving a clear example of the point that they're making. So the point that they're making is that they have developed strong skills in building therapeutic relationships and managing challenging behaviors and working collaboratively. And then they kind of bring in that example to sort of evidence it. What could be good here? So I guess I'm thinking that we do have quite a lot of points here, and I wonder whether it would be better to just focus on one or two of them, because actually it seems, let me just have another read through. So my translate. Yeah, because I guess what I'm thinking is I'm wondering which person specification criteria is it addressing. So the strong skills in building therapeutic relationships, if we look at the person spec here, I'm trying to think what would that necessarily correspond to. So it could correspond to knowledge of mental health. It could correspond to an understanding of the needs and difficulties of people with mental health problems or other disabilities. And then that seems like it would be it for me. So if we're talking specifically about building therapeutic relationships, it could address those. But I'm maybe concerned that it's not making it explicit enough. So when you are approaching these applications, you really need to think about how the hiring committees are going through tons and tons of applications, and they've basically got this person spec in front of them being like, okay, I'm just going to tick off all the different person spec points that are in this statement. So you want to kind of give it to them as easily as possible. So, rather than kind of having them infer these things, you could consider saying something like, I've developed strong knowledge in mental health, particularly in building therapeutic relationships. So we're getting that keyword in, and we're not losing any of the depth that we're kind of talking about here, because building therapeutic relationships is quite an integral part of working in mental health. So I hope that makes sense. Again, it's sort of kind of free flowing coming out from my mind and just my overall thinking process. But even when we're talking about multidisciplinary professionals, yes, it does correspond to an ability to interact effectively with staff from all disciplines, but we're not really, if we look at the example, we're not really seeing that too much. So how did this person actually effectively interact within that multidisciplinary context? So again, it's really about being very specific and using their keywords when you are writing the statement, and making it as easy as as possible to determine whether, okay, this person meets this criteria, we can tick it off. So I'll just keep going down, and actually maybe something to highlight is that we potentially may not be able to go through each statement at its full just because of time. But again, this is all maybe just a bit of like a learning opportunity for me as well, just to ensure that maybe next time we could just do one statement and really go at it in depth. But for now, yeah, if we don't get to the end, then we'll just move on to the next one. So if we look at academic backgrounds, so through my academic background, I gained knowledge of qualitative and quantitative research, databases, and data analysis. Great. So this would correspond with experience of quantitative research. If I'm being really pedantic, I would even say I gained experience of qualitative and quantitative research. But that is also maybe being a little bit more pedantic. So throughout my years, I've been able to practice and improve my report writing skills. And so there should be usually an "and" after here just to make it grammatically correct. And this was shown in my master's thesis, where I achieved a distinction. My thesis was researching about the effects of chronic stress on human attentional processing. During this process, I used validative measures such as the DAS-22, the perceived stress scale, the attention network task, and the sustained attention to response task. I conducted a little typo here, a quantitative analysis of the scores of everyone, organized demographic data in Excel, and used SPSS to analyze outcomes. I presented my thesis at my university's postgraduate poster conference, and I also conducted a presentation about my thesis for my course. Okay, so from this paragraph, we've got knowledge of quantitative research, so that would be addressing that point, so that's good. And then we've got experience of quantitative research as well, and we have skills using microcomputers for databases or data analysis, especially SPSS for Windows. Lovely. And then let's find the high standard of report writing. Okay, so we're actually touching on quite a few points of the person spec here, which is great. I think it is also nice that the person gave a bit of context on what they actually did as part of their thesis, just so it gives the reader a little bit more context into what the person's actually done. And I just want to double check the desirable criteria. So we have something here around presentation skills. And I imagine that this sentence is trying to address this part, which is great. But what I would say is, again, very similar to the paragraph before, and I think this goes for all the person spec points that this person has technically covered, is about using those keywords again. So, you know, rather than kind of implicitly saying like, yes, I presented my thesis at my university's postgraduate poster conference. I mean, that's amazing in itself. And I also conducted a presentation about my thesis for my course. it might be better to phrase it as I developed good presentation skills through presenting my thesis at etc., etc. Again, just using those keywords. Same with the high standard of report writing. So rather than saying I have been able to practice and improve my report writing skills, I would just go straight into it and say I developed a high standard of report writing when I wrote up my master's thesis. And you could even give more of like a quantitative number there around like what was the word count, because that might also sort of indicate like, okay, you've actually written quite long pieces of work in that sense. But I think overall this is quite a good paragraph. It seems like we're touching on a lot of the different aspects there. And then I'll just do this last paragraph, I think, and then I will move on to the next one. So my enthusiasm for research was further developed during my eight-month placement where I worked as an honorary AP. I collaborated with a multidisciplinary team, including clinical psychologists and recovery workers to help individuals experiencing homelessness and substance abuse. I was tasked with collecting data for a service evaluation, which consisted of questionnaires and interviews with clients who received psychological support for the service. I also created a psychologically informed service evaluation questionnaire that was collecting data from the peer mentors and other staff regarding whether they had trauma-informed psychological support from the psychologist working in the service. Okay, so in this paragraph, I guess when I'm thinking of the person spec again, it is touching ability, sorry, not this one. Where was it at? An ability to interact effectively with staff from all disciplines. But again, we're not really kind of touching on it enough, maybe. So, and maybe it is more about the language use. So, you know, rather than saying I collaborated with an MDT, how did you collaborate with them? What was your role in it? Were you discussing care plans? Were you discussing risk? Were you, you know, there's lots of different sort of tasks and things that you can get done within an MDT. Or was it around this task of collecting data for the questionnaires and doing a service audit? But again, that's not really clear, actually. So I think maybe a bit more clarity here would be good. And again, stating that, you know, you did develop this ability to interact effectively with staff from all disciplines, such as when I worked in an MDT, including clinical psychologists and recovery workers. And then again, giving an example, what were you collaborating about? What was it exactly? And then I was tasked with collecting data for a service evaluation. So I wonder whether this part would be touching on experience of research in the NHS. I'm not sure if this is an NHS post, but it sounds like it could be. And if it is, I would explicitly say, and to be fair, this person probably got rid of it just to sort of keep the statement anonymized. But just for the sake of everyone else's learning, it might be a good idea to sort of bring in, okay, during my research experience in this NHS role, I XYZ. And I also create psychologically. I guess I'm curious about what this is really targeting here. And other stuff, whether they had trauma informed, it feels maybe a bit vague to me. I'm curious what is kind of meant by a psychologically informed questionnaire. So whether was it kind of drawing from other questionnaires, in which case you would kind of be drawing on an ability to apply existing knowledge to a mental health context. I'm just looking again. I think maybe a bit more clarity around what's the sort of purpose of this sentence here. Again, because this statement is maybe slightly on the longer side, not by too much, but maybe a little bit. And again, we kind of just need to put ourselves in the position of the reader, that they are going to be reading a lot of applications. So you really want every sentence to feel as though it has that purpose. It's really adding. It's not just something that like, oh yeah, this is a really cool thing that I did, but how does it relate to the person spec again? And I think if I were to really spend time looking at the person spec, we could probably link it somehow, but I think it just needs to be a bit more explicit. But yeah, so let's leave that there just so we can have a look at the other statement. So I'll just close this and I'll close this. And then we've got my other two bits here. So we've got the person spec. So let's just have a brief look. So standard education qualifications, paid or unpaid work with people with mental health problems and or disabilities, knowledge of evidence-based practice, and we've got quite a few desirable criteria here. So paid work and direct care provision. Okay. High level of communication skills, ability to communicate sensitive info, understanding of the needs and difficulties of people with mental health problems, ability to apply existing psychological knowledge, computer literate. So quite similar to the other person spec. It does go over a few of those core competencies of an AP role. Demonstrate graduate level knowledge and experience of research and methodology. An understanding of psychology applied to healthcare. And then some of these, yeah, exact same that we had before. Okay. So fairly standard again. So let's have a look here. Let's move you a bit more here. Move this to the side. Okay, we'll move to the side. So as an aspiring NHS clinical psychologist, nice. So we're specifying that this person wants to work in the NHS, so they know that if they're making the investment, you're going to stay. Great. I'm excited to apply for the assistant psychologist post within the neurodevelopmental assessment team. I'm committed to improving access to mental health care through intersectional evidence-based approaches. That's nice. That sort of ties into a little keyword there. That are informed and co-produced with neurodivergent people. Working within a team that emphasizes neuro-inclusive practice reflects both my clinical interests and personal values. I would be eager to learn how mental health care differs for neurodivergent groups and how psychologists can adjust their practice to suit diverse minds. The trust commitment to care that is compassionate, respectful, and transparent aligns with my personal principles, and I believe working in an environment that emphasizes these values would provide a meaningful opportunity to develop into a positive leader as I progress towards clinical training. This is really good. I think this is an excellent opening paragraph, actually, because again, you're specifying that, you do want to work in the NHS. You're also highlighting your values and your interests, actually. So you are interested in, working within a neurodivergent service, and also highlighting that you've done your research on the team. So it sounds like for this service, neuro-inclusive practice is quite important. And we're sort of showing that we know that right from the beginning. And this sentence here, I think it's a really, really good sentence. And the reason for that is because we are, let's see if we've got the values. Oh, no, it's not here. But we are highlighting the trust values, which is something I would encourage everyone to do. But I sometimes feel like it's nicer to end with this. again, you're not going to get penalized for putting it at the beginning, definitely not. But I think I would have liked to just get started after this sentence. So, okay, this person is really interested in working the team. She's interested in working with a specific service. All right, let's get into why is, sorry, I'm actually assuming gender here as well. I don't know the person's gender. But yeah, you know, they're interested in this specific area of psychology. And then as an ending, I think it is nice to end with the trust values, just to sort of kind of wrap it all together. So let's go to the next paragraph. So through my undergraduate studies, I undertook modules which expanded my understanding and the needs of difficulties of people with mental health problems and other disabilities. Through my module focused on sensory and social differences in autism, I became interested in neurodivergent affirming care and the role of co-produced research in developing support-based models of care. I sought to expand my theoretical knowledge of evidence-based practice by undertaking several roles with individuals with neurodevelopmental differences, mental health issues, and other disabilities. This included providing one-to-one and group interventions to students focused on stress management as a welfare officer with my university, enhancing both my interpersonal skills and ability to facilitate discussions regarding sensitive topics. So I think we can already see here that we've got some keywords already listed. So this person has highlighted that they have an understanding of, let's go find this, have an understanding of the needs and difficulties of people with mental health problems, and then they give evidence of how they achieved it. So it sounds like they achieved it through a module throughout their undergraduate studies. Perfect. Something to maybe take this to the next level is adding in some theory. So, you know, the double empathy problem, double empathy theory in autism might be something interesting to sort of bring in. Again, it is quite a small detail, but I think it would just highlight even more that, you know all the different theories that are related in neurodivergent affirming care. Or even like the social disability model or something like that. But that's quite a small thing, I would say. And then I sought to expand my theoretical knowledge of evidence-based practice. So we've got knowledge of evidence-based practice by undertaking several roles working with individuals with neurodevelopmental differences. And okay. So I would like a bit more specificity here, actually. So what were these roles? Were they support worker roles? Was it a previous AP role? Was it a recovery worker role? I think I'd like a bit more context here because it does feel a bit vague. And even when we're talking about mental health issues, some examples would be good. So, you know, were you working with psychosis or were you working with anxiety and depression? Because those two things are quite, you know, it kind of infers a different sense of the type of work that was being done, actually, and maybe the risk that was involved. So I think being specific around that is quite helpful. And then this included providing one-on-one and group interventions. So this is good, but I would say we could make this more specific and say, I also developed, I'm just kind of like throwing it out there, it doesn't need to be worded in this way, but I developed an ability to apply existing psychological knowledge in these roles, providing one-on-one and group interventions. Again, you're just making it really specific that you're addressing this criteria. And I would even specify what are these interventions. So, and we're kind of highlighting here that it's students. So were these several roles done in educational environments? Or was it just one role? I think this makes it maybe a little bit confusing. It seems like it was focused on stress management as a welfare. Okay, so as a welfare officer within my university. But okay, yeah, now that I'm just reading this sentence again, we do have some specificity around what role it is, which is good. I think one thing, again, sort of like going back, this is like how my brain works. I'll just hop from things. But I think I would just like to get a sense of what theory was involved in these interventions. So it's stress management, okay, but what does that look like? Was it kind of CBT oriented? Was it more psychoeducational? Because stress management is quite vague. It could actually be so many different things. And I think by also mentioning a theory, again, it just gives you a bit of that leg up that shows that you are aware of, you are aware of different psychological theories and how they can maybe be applied. And this is also something, if we look at this person spec, that you could draw on, that it's an understanding of psychology applied to healthcare. So how are these theories being applied within a healthcare environment? I hope that all makes sense to people. And then I will just go onto this one, and then we'll start with the Q&A. So during this time, I was employed in the direct care provision as a specialist support worker. So I think there was, here we go. So it's in the desirable criteria. So paid work in direct care provision, perfect. I expanded upon my knowledge of psychology as applied to healthcare, great. So we've got that person spec being addressed. By employing psychological techniques such as behavioral activation, crisis management, and trauma-informed practice when interacting with service users. Nice, really good. Additionally, working within an MDT setting taught me that if I am to interact effectively with staff from all disciplines, then it is necessary to work collaboratively and learn about the role different care sectors play in providing care to patients. Really, really, really good. This is great. So the reason it is because we've got 3 different person spec points being addressed here. So my knowledge of psychology as applied to healthcare by employing psychological techniques such as BA, crisis management, and trauma-informed practice. So we're giving a direct example of how they meet the person spec criteria. And then we have working in an MDT setting taught me that if I am to interact effectively with staff from all disciplines, which we have here, then it is necessary to work collaboratively and learn about the role different care sectors play in providing care. So how I could, maybe just tiny little things on how I could improve this, and it's even just one thing actually, is again just giving a sense of what are the different care sectors that this person has engaged with or interacted with. So, you know, was it social work? Was it nursing? Was it psychiatry? Was it occupational therapy? Was it dietetics? There can be loads of different sectors actually that you would engage with within an MDT context. So again, just giving a bit of context to the reader, like, okay, what are all these different care sectors? Because maybe right now it does seem a little bit vague. But again, it's a fairly small thing, I would say. And then maybe another thing is by employing techniques such as BA, crisis management, and trauma-informed practice. So I guess I'm curious around in what capacity was this done? So was it in one-to-one work? Was it in groups? Was it like, what was the kind of format that this person was using these psychological techniques? because again, it maybe does just feel a little bit vague on that front. I'd maybe just like to have a bit more of a sense of what were you actually, what was the responsibility that you were undertaking that you actually used these specific things. And I think we will leave it here then. Something I wanted to add, and I didn't do this for the other statement, but I would normally do this. I would usually copy and paste a small, I'm not able to do it here for some reason, but I would normally copy and paste a small section of the person spec and then do control find and see if the person has talked about it. So some of these might be a bit more difficult to sort of find if they're being spoken about implicitly, but for example, let's see. For example, here, supervision is a person spec point, and if the person's not talking about supervision at all, then that's automatically going to mean that they're not going to get shortlisted because it is an essential criteria there. So I can just do it really quickly here and see. We've got supervision. Okay. So we actually don't, or if we have supervisor. Okay, there you go. Having these discussions with my supervisors. So I will just do a really small little commentary here, just for the sake of explaining it further. But my reflective diary is helpful in identifying my triggers and encourages self-compassion. I prioritize working in environments where I feel comfortable having these discussions with my supervisors. I'm not too sure whether that does address the idea of supervision. So when you're thinking about this person spec point, you would want to consider, obviously reflective practice is part of supervision, but I'm not sure if it's really selling itself here as much on that the person is really accepting supervision and using it effectively. So, some instances where you might do this are when you're dealing with risk, or you're, managing a caseload, or you're kind of trying to organize yourself in relation to all your different responsibilities. These are times where you would really need to use it and accept supervision and use it appropriately and effectively. So that's just something to consider. And I did just want to highlight that is the control find sort of technique is what I usually do when I am reviewing and critiquing statements. And I will normally comment on that as well to the person. But yeah, I'll stop sharing my screen now. So I wonder if anyone does have any questions about that, or any kind of thoughts or anything that sort of felt a bit unclear. Yeah.
I was actually wondering, I have done primarily roles that have involved care within the adult population or forensics. So what I find quite tricky is being able to show transferable skills to other kind of disciplinaries. So like, for example, eating disorders or CAMHS, for example. So CAMHS is a really difficult one to get into, as it is if you've got less experience with children. So I was wondering if there's anything that would be helpful to write down in a statement like that.
Yeah, that's a really good question, actually, because I think with some of those specialized services, you're right, it's not impossible, but it is a bit difficult to sort of demonstrate competency in CAMHS if you've never worked with children or adolescents. I guguess what I would suggest is on some of those person spec points where, and this would usually be in every AP role, where they sort of highlight, an understanding of mental health, knowledge of mental health and the needs and the needs of service users and things like that, really highlight that you're aware, and maybe through your studies or through your own research, that you're aware of the needs of that specific population. And what you could do is, when you are sort of talking about the experience that you have, is highlight how it could be transferable to CAMHS. So, for safeguarding, for example, safeguarding is sort of the same across the board, other than when it does come to every service is going to be quite different, but when it does come to children and adolescents, the idea of consent and confidentiality might be a bit more problematic, or kind of tricky. So even sort of highlighting that if safeguarding is a criteria there, stating that you've done, you've worked or handled safeguarding issues, and you'd be aware that things would need to be different, essentially, when working in CAMHS. But I think there are quite a few. Again, it's kind of difficult to say without sort of seeing the person spec in front of me, but yeah, I hope that helps. I don't know if it does, but
No, that makes sense. So even when, say, for example, I were to pick up an eating disorders team to apply to, so do you think it'd be helpful to highlight any kind of like theories that I've come across while I've researched about it? Because I think that has helped in terms of like an adult population, for example. I've got it, but obviously I think there's quite more reading around it as well, isn't it? Okay.
Yeah, definitely. And even, in your undergraduate studies, if you had a lecture on eating disorders or CBTE, or like the treatment for an eating disorder, you can draw on that as well. Just because you didn't do an entire degree on eating disorders, it doesn't mean that you can't draw from the knowledge that you got even from that one lecture. So yeah, it's kind of just about, it's not about embellishing in a sense, but it's kind of just about being tactical, like when have I actually been exposed to a child or adolescent or to someone with an eating disorder, even in like the kind of smallest sense, because then you can sort of bring in that, you have done your own research, these are the treatments for it, this is how you handle it. So yeah,
because sometimes they do also encourage, other than professional experience, bringing in personal experience, I've heard.
Yeah.
Okay.
Yeah, exactly.
Thank you. Sorry for taking so much time.
No, that's okay. If someone else wants to go. Sorry, I'm just trying to see all the hands. Sidra?
Hi. Thank you so much for this session. I have a question that may sound kind of basic, but it's a debate that's been going on for a few years. In terms of formatting your personal statement, I've heard from people who say, you should have a narrative format, but equally, you should also have some headings. Now, I really struggle to kind of find the right balance. So I do both. I do a narrative format, then I add headings onto it for whoever wants to need it. And I mirror my headings to the headings in the person's specification. Sorry. Yeah. To kind of, but I just wanted to hear your thoughts on what you think is right. And one thing that I've really struggled with when I'm writing personal statements is when I try to hit each and every single criteria, I try and give an example to show how I meet each and every single criteria. But then what happens is my personal statement goes on to 1,500 words, and that's not what we're looking for. I think the gold standard is around 900, 700 to 900 or something.
Yeah.
How do I kind of balance that? Sorry for the loaded question.
No, that's okay. So to answer the first part of the question, so in terms of structure, so it is really hard because each service is going to be really different. So the way I managed to get all my AP roles and interviews was through a narrative. I never did the bullet point and any headings, and that just seemed to work for me. And I think it's worked for other people as well. But for example, I know that in my current service right now, that they do prefer the bullet point thing. So just, get each person's spec point and then highlight how you meet it. And that's what they want. So to a degree, it is a bit of a gamble, which is not really reassuring. But that's why, and sort of what I highlighted in the first statement, that even if you are doing a narrative, I was going to say narrative formulation, narrative statement, each sentence really has to have a purpose, so that even if someone maybe has a preference towards headings and bullet points, that if they see your statement, because it is so concise and because every sentence has value, it has a purpose, you know, they can kind of overlook that because it's an easy read in that sense. So I guess to answer your question, it's going to always depend. And I think ultimately it comes down to what feels better for you as well. How can you, what makes you feel like you can write in a more concise way? And then the second part of your question, so yeah, feeling like, yeah, you need to add an example for every single person spec point or criteria. I think you do for the most part, but sometimes you can group them together. So an example that comes to mind for me is that person spec criteria of an ability to interact effectively with staff from all disciplines and high-level communication skills. So if you're doing a narrative statement, you could sort of combine those, because the ability to interact with staff from different disciplines does involve quite, you know, you do need good communication skills in that sense. So you could even do it in a sentence. I'm just going to kind of like throw it out there, but you know, it could even be something like, when working with an MDT, I had to interact effectively with staff from XYZ disciplines when discussing care plans, and this involved high level communication skills, such as I'm trying to think, even like active listening, for example, can be seen as a communication skill, or, you know, making sure that yeah, I'm trying to think just from off the top of my head, but I don't know if that makes sense. If you sort of combine the two.
Yeah, and as you said that, I realized communication is a big one that comes up in person specifications, and there's not just verbal communication, there's written communication, and
yeah,
you know, an example of that, you can tick a lot of boxes as you go. So you're right, it's just a matter of picking your examples in the way that which example hits most person specification points, you know. Yeah, it's quite difficult, but I get what you mean.
Yeah, and I think I should have prefaced this at the beginning. It is very difficult, and you know, on top of them asking you to hit all these person spec criteria, they're also asking you, in the reality, to do it very quickly, because the posts close so quickly as well. But I think what can be a savior for that as well is, once you do have a base, and once you've written a few statements, you can just use them as a base, because as we even saw today, like so many of them are overlapping anyway. And then it's maybe about thinking again, like, oh yeah, which are some of these criteria that actually go together? So, you know, an understanding of mental health applied in, or an understanding of psychology applied in a healthcare context, can actually coincide with knowledge of psychological theory. You know, you can bring those two together. So I think a lot of it is, part of it is maybe just being a bit creative with it as well.
Yeah, definitely. Thank you so much for answering it in such great depth. It's really helpful. Thank you.
No worries. And then T.
Hi, firstly, just to say thank you so much for today. It's been really helpful. And I
Sure.
just wanted to ask, when we finish writing a paragraph and we've sort of done our example and everything, do we need to link how that skill can apply to the role? Like explicitly. So this would help me in the AP role because XYZ responsibilities.
You don't need to, unless there's something specific in their instructions in the supporting info bit that they say, like, please specify how this is relevant to the role, which I think I've maybe seen a couple times, but not that often. I wouldn't say that you need to, because that much is implicit. You know, you're applying for this specific role, and the whole idea of a person spec is just to demonstrate how you meet these criteria. But then saying that, you know, you're not going to get penalized if you want to do it a couple times, especially if maybe for the person who asked the question around kind of specialist knowledge or specialist service, and you feel like you need to fill in a little bit of a gap there that your experience has or doesn't have, in a sense. But I think generally I would say you don't necessarily need it.
Okay, thank you. And that's good to know, because the word count, like we mentioned before, we don't want to be writing too much.
Yeah. Great. I'll take 2 more questions. So I've got one from Eden.
Hi, thank you so much. This has been really helpful and really informative.
Sure.
I just had a quick question. Do you feel like there are any experiences that services specifically look for? I know it depends on the type of client group, but are there any common experiences that people who have been successful with securing AP roles have? Because I know from my own experience, it could be hard to know why I'm not progressing and why I'm not getting interviews, whether that's my own experiences and things that I may be lacking, or if that's the way that I phrase my statement, that I'm not putting across a person spec properly. So yeah.
Yeah, I think that's a really good question. I think the common experience that would give you, in my opinion, objectively a leg up would be if you have some sort of one-on-one, if you've done some sort of one-on-one intervention with someone, which I know is the most difficult to attain. But the reason for that is because you can just take off so many different criteria with it. So, you know, you can take off the understanding of psychology in a mental health context. You can take off the applying psychological theory to the role. If there's anything around like risk or safeguarding, maybe some of those things have come up in a one-to-one session. And I'm trying to think of all the criteria. They're like gone from me now, even though I've just spent the whole time looking at them. But I would say that you seem to be able to tick off quite a few things if you do have one-to-one. And I maybe should specify, because I did say one-to-one interventions. It doesn't need to be like, oh, I'm doing this concrete CBT intervention and we've got 6 sessions and that's what we're going to be doing. You know, even as a support worker, if you're meeting with them one-on-one, you know, you're bringing those active listening techniques, you're bringing in empathy, which I don't think maybe people speak about enough, actually, because whilst we might not consider empathy a technique, it is the core part of working with anyone or any service user, anyone who patient or anyone who's accessing mental health. So yeah, I think that would be my answer for that question. And yeah, just making it clear that it doesn't need to be this kind of formal, you know, I'm doing systemic, I'm doing CBT with someone. But I'm also just trying to think because I know that that's also the most difficult experience to get. Yeah, that is the one that comes to mind, to be honest, but that is good food for thought for me, actually, because maybe that's something I can also think about, even for like I can write a post about this, for example, if people want it. Yeah, I hope that helps.
Thank you. That was really useful.
Yeah. All right. Well, I don't think we have any other questions. And we're right on time, actually, which is great. So I did just want to say thanks to everyone who came today. I do realize that I think a few people were trying to get in midway and I wasn't able to let them in, which is unfortunate. But yeah, I think it was just the reality of doing the webinar solo. But yeah, I'm really thinking of all you guys. I really hope, you know, things go well for you with your applications. I know it's really, really hard, but just keep going and keep persisting, and you'll get there eventually. And you know, as always, if anyone has any questions for me, you can reach out to me on LinkedIn. I do also have a website as well. It's psychologycareers.co.uk. And I've got a blog. I post some things around, you know, how to build experience, how to do AP interviews, all those things. And I also have some guides as well on my website that have proved to be quite useful for me when I was applying, but also for my coachees as well, and the people that I mentor. So yeah, it's really good to see everyone, and best of luck.
Thank you.
Cheers.
Thank you.
Bye, everyone.
Thank you so much. Bye-bye.
Bye.